Right, good afternoon, everyone. We'll just give it one more minute before we get started. All right, let's get going here. Hello, everyone, and welcome to our industry showcase, October 14th. My name is Ashley Caesar. I am the programs and event specialist here at Digital Health Canada. And during the month of October, Amazon Web Services presents Cybersecurity Awareness Month. And today's industry showcase is Cybersecurity Transformation, the critical connection to digital health innovations. So joining me today, we have Erin O'Halloran. She's a healthcare enterprise account manager, Western Canada with Amazon Web Services. We will have time for Q&A at the end of today's presentation. Please type your questions in the chat box at any point. And thank you all for being here today. And I pass it on to Erin.
Thanks so much, Ashley. And just to reiterate what Ashley said, we can see all of the questions, so please send them in real time. You're probably all virtual meetinged out, but we'll try and make this as interactive as possible, even though we're coming in from all different spots. It's a pleasure to virtually see and meet everybody. So just to make sure that's working and get you all engaged so you're not multitasking, if you could drop into the chat what kind of morning or afternoon beverage you've got in front of you. We'll see what everyone's saying and what everyone's drinking. I'm on my second glass of water. It's 9 o'clock here. I'm on Pacific Coast in Vancouver. Let's see what everyone's drinking. Coffee and water. Drex is in Seattle with coffee. Cheers. I need some more water. Go get some. Green tea, coffee in Virginia. Awesome. Dark roast coffee. That's a coffee purist. Awesome. So it looks like morning for most of us, but if not, good afternoon. I'm really pleased and humbled to be on this panel. I'm not actually physically on the panel, but I'll be moderating. As a healthcare account manager at Amazon Web Services, supporting our customers with over 200 services, I am in no way the specialist on any of them. We've got whole teams of super smart, talented people to support us with these discussions. And so I'd like to introduce first Merritt Bear from AWS. So she is a principal in the office of the CISO at AWS, providing technical cloud security guidance to complex regulated organizations like the Fortune 100. And she also advises the leadership of AWS's largest customers on security as bottom line proposition and builds strategic initiatives for how we as AWS secure ourselves running on AWS. We are also an AWS customer of our own. She's a regular speaker on InfoSec, a graduate of Harvard Law School and Harvard College. She's admitted to the bars of New York, the United States Court of Appeals for the Armed Forces, and the United States Supreme Court, and based in Miami, Florida. I could go on and on about Merritt's credentials, but I would take up half of the panel. So pleasure to meet you, Merritt. Good morning.
Good morning. Thanks for having me. Coming from Miami on Tequesta, Miccosukee, and Creek land here.
Awesome. Welcome. And Robert and Drex will get a heads up. I'm asking everybody to tell us one thing about themselves, non-security related, that might surprise and delight the audience.
I once won an award for saving a life.
That's a small.
It's a good story. Now we have one for the next one.
That's a great one. Thanks for sharing that. Okay, over to Drex. Drex DeFord has broad experience as a senior healthcare executive, including 20-year U.S. Air Force officer, culminating as the CTO for Air Force Health and their worldwide operations. After retiring from the military, you look far too young to be retired already, Drex.
Thank you.
You served as CIO at Scripps Health, in San Diego, Seattle Children's, and Steward Healthcare. You're past chair of Chime's Board of Trustees and has served on the HIMSS National Board. Over the past several years as an independent consultant and recovering CIO, you've helped lead trust, health systems, payers, associations, vendors, and investors through their work on healthcare's toughest problems. And just in March of this year, you decided to join CrowdStrike as their executive healthcare strategist, and are passionate about the mission to stop breaches and better secure clinical research and healthcare business operations. Pleasure to have you, Drex. Thanks so much for joining us.
Thank you very much. And now you want to know one thing about me that nobody
sure
probably
do.
knows. So way back in the day, right after I graduated high school, I was a radio DJ for about 3 years. So I've done a little radio time.
Well, you definitely have the voice for it.
Listen to that rich voice.
Thanks.
So much more enjoyable for the people listening. That's great.
Awesome.
And last but not least, a valued customer and CISO at Alberta Health Services is Robert Martin. Robert's portfolio includes governance, risk, compliance, policy development, security technology, architecture and oversight, disaster recovery, IT risk management, and service management. So no small things that you're responsible for. In addition, your team is responsible for deploying a security awareness program to 100,000 staff, physicians, and volunteers across Alberta. And for those of you not in Canada, Alberta Health Services is the largest health system in Canada. And that's already in your bio. AHS is Canada's largest healthcare delivery organization responsible for providing health services to over 4 million people living in Alberta. The combined workforce of staff, physicians, and volunteers make it one of the biggest, most complex, and most dynamic organizations in the country. Welcome, Robert, and thank you so much for investing some of your time with us in the audience. And your surprise and delight piece of information.
Well, I was going to say that I'm a big tabletop role-playing game fan, but Merritt made me seems kind of trivial. But maybe I'll say that my first job, back to Drex's point, was that I loaded propane and butane into rail cars. That was kind of an interesting job, but that was my first job back many, many years ago.
Well, where security was also critical.
Physical security, not
physical security.
Cybersecurity back in those days.
Right. Okay, well, thank you everyone for joining us. Again, it's meant to be an interactive discussion. I'm moderating the chat, so please provide your questions or feedback throughout the discussion. It's been a nearly perfect storm this past year for cyber criminals in healthcare. In the healthcare industry specifically, it's cost more than $20 billion in downtime, and nearly 18 million patient records breached. No one is immune to this. It's happened in Canada. It's happening in healthcare systems all over the world. And then all of this is happening in the midst of a relentless demand to transform healthcare through the implementation of digital health strategies, products, and services. So it wouldn't be 2021 if we didn't start out with a little bit of discussion on the global pandemic and COVID and how that outbreak has had a spillover effect on the cybersecurity resilience of healthcare organizations. So increase in remote work, it's made healthcare organizations in Canada and globally much more vulnerable to network penetration during COVID-19. So Merritt, as AWS, we are not immune to this either. How have you seen in your role in the office of the CISO, has COVID impacted us in terms of cybersecurity approaches and how we've changed our own business?
That's interesting. So I think, folks have adapted as you would expect. And, one of the beauties of cloud is that you can spin up and spin down. So areas of your business that may not have been as heavily invested in before now make more sense. Things like call centers and other things that are, enabling that remote work. So I think the first big change is just on the business side and how we adapt to our customers as they're changing during this time. But I think in security, conversations, it really has prompted like a growing up that a lot of shops were due for anyway. When it comes to, embracing, the perimeter is dead, long live the perimeter, right? So embracing, this year, the buzzword has been zero trust. And to me, that connotes the approach that you reduce possibly down to zero, the relevance of your particular position within the network, whether that's a human identity or a piece of software. And so in order to do that, you have to move beyond this sort of traditional trust model where everything inside the perimeter would be trusted, but, you know, still employ perimeters to do some of that signal to noise filtering and couple those with identity-centric fine-grained permissions. And so it really means that you're approaching, you know, trust boundaries and identity in a much more nuanced way, in a way that allows for that kind of fine-grainedness, which, by the way, you know, is going to be good for your business in general. So I think it's been, in some ways, kind of a forcing function for shops to, you know, embrace, well, to move to cloud even more and to embrace that, you know, mix of both perimeter and fine-grained identity-centric controls.
Okay, great. Thanks for that insight, Merritt. Drex, as the other industry panelist on the board, I'll ask you the same question around CrowdStrike and how COVID has changed your business there at CrowdStrike.
Yeah, I still, you know, I kind of, as a recovering CIO, I kind of can't help myself. I always still think about this stuff from the perspective of the health system. And so, you know, one of the things I'll do is start off by saying thank you for everybody who works in healthcare, because I don't know what we do without you. My wife is a pediatric ICU nurse, so I only have some inkling of how busy and crazy things are for you right now. But thanks. And the other thanks I would say is to the health IT and information services teams who kind of were the backbone of a lot of the pivots that we made early in the pandemic, everything from sending everybody to work from home, but connecting to new suppliers because we couldn't get enough PPE, and, you know, taking telemedicine and telehealth to the next level, and setting up new locations for delivery of care like remote testing, and adding new equipment quickly, whether it was ventilators or lab equipment. I mean, you know, you all really did backflips, which was, it was super impressive to be, you know, an outsider at that point and kind of watching the work that was going on. But as I talked to CIOs and security folks, it was also clear that we bent a lot of our own rules in this process, which meant that we were left more vulnerable. I think it was challenging to keep track of all of those adjustments and changes. And I know there's a lot of projects going on right now tied to remediating some of that work, making sure that we're secure, making sure that we have new capabilities to kind of support the new reality of work from anywhere that we have today. And now that end users kind of work from anywhere, those endpoints must be protected in a whole new way, because work from anywhere means the concept of the network perimeter has changed. So in Merritt's words, you know, long live the perimeter is dead. And during all of this, there's been this crazy drastic increase in ransomware and the number of sophisticated adversaries and the way that they attack and why they attack, because we've been really good at paying them in a lot of cases. So there's a lot of money in this business, and there's a shortage of cybersecurity professionals. So it's kind of, you know, you talked about the perfect storm kind of in the beginning. It really is kind of a perfect storm that's driven the work that we do at CrowdStrike to try to create products and services that clients tell us are some of the most advanced, yet some of the easiest to use tools that they've ever encountered, which helps them sleep at night, which is probably really good because they have a lot of work to do tomorrow.
We definitely want Robert to get more sleep.
Yeah,
Robert needs more sleep.
You can probably see the bags under my eyes, but it's not just me. It's you know, all the team. And to Drex's point, you know, we're here to enable the people that are delivering healthcare. So I think that's been, you know, we're busy, but we're busy because we need to be busy to support them. I think that's the really key message there for sure.
Yeah, and lots of plus ones and echoes from the panelists on that. So a huge thank you to everyone working in healthcare with all that's going on. Absolutely. So thanks for that, Drex. So, you know, during the first meeting when we all met each other for the first time, well, Robert, I've met you before, and Drex, I've met you before. Merritt, this was our first time interacting, and the first time we all sort of met to chat about this panel, Robert said, you can't do delivery of digital health without a transformation of cybersecurity overall, which is a pretty profound and compelling statement, likely music to Merritt and Drex's ears. What do you think are some of the pillars and cornerstones of that transformation, Robert?
Well, I think it's back to the point that Drex made in the intro comment there, where, you know, there were organizations that really responded quickly and maybe deprecated their security posture a little bit, right? I think Drex said that a little bit more eloquently than I did. But when we sat down in March of 2020 as a team, I said very clearly that if we aren't able to to respond extremely quickly, then we're just going to get left behind. So how do we become more agile? How do we become more lean? How do we become more responsive? How do we, meet our clients, meet our partners, our vendors in a way that is going to get those processes changed? The organization did try to work on virtual health for a lot of years, and then all of a sudden virtual health becomes a real big thing all of a sudden. And it was fantastic to see from a healthcare strategy perspective, but what's our role in that and how do we respond? So I think right off the bat, our ability to respond quickly and find ways to be more efficient was absolutely required so that we weren't left behind in all of these conversations, right? Instead of doing things in parallel, do things laser beam focused as quickly as possible, days instead of weeks from a decision perspective. And I think that transformation from our cybersecurity program is what's going to help us continue going forward. I'm not sure that we can keep up the pace for another couple of years or permanently, but I think the lessons that we learned and how to be more efficient, how to be more responsive are cornerstones to our strategy going forward and just our way of doing business.
Yep, that's great. Drex, I'm going to save you for last on this question because I know digital transformation through the security lens is one of your favorite topics, but I'll go to Merritt in between and say, in your experience working with executives in various organizations, not just healthcare, what do you see as some of the pillars and cornerstones of this digital transformation through, cybersecurity considerations?
Yeah, I think one of the, at least the ways that I heard Robert's statement and even some of the sort of keywords that he just mentioned, it really pulls out so he said something like becoming agile, and I would use that as the term of art too, right? So moving from a waterfall to an agile methodology, what that really means in practice is that you're weaving security in from the start, which sounds like a cliche, but it is literal. So, the way that you've set up your permissioning, the way that you are looking at architectures, considering whether you've done the most default secure thing as the, premise, those kinds of considerations are actually built into the way that you do architectural decisions, especially in more abstracted environments like cloud. And of course, there are services that are managed so that folks are doing less of their own, Lego building on their side, which can help with that kind of delivery. But overall, I think that the main shift that we're seeing that I think COVID has accelerated, but I think we were due to mature in this sense overall. And it's one thing that we continue to work on internally is to kind of figure out how to weave in that, security engineering into all that you do and make sort of security a first-class citizen. And a couple ways that we mechanize that at Amazon are, one, we have security engineers embedded. Right now, we have a 1/8 ratio on service teams. That's something that will probably change. But for now, that's kind of like the magic number that we've settled on in those 2 pizza teams that do our development. We have, forced blameless escalations. So your executives have to know they're going to answer the phone for security, although we keep our environments really permissive so that employees can do a lot. There are elements of this that can be mechanized. It is not just good intentions, and it is not just yay, security everywhere. It's got to be turned into how you actually build. And I think, again, if folks have ideas for what's working for their teams, feedback is open and would love your thoughts here. But I think overall, that shifting left, that movement to weaving security into all you do, we will still have an AppSec process, but it's not just about clean code, right? And the way that you're inspecting your environments for security considerations also looks different. So you can do automated code reviews. You can do, coming back to known good states, whether it's golden AMIs or, CloudFormation or Terraform templates where you're templatizing and coming back to immutable architectures, those kinds of things that you can take advantage of. Sorry, this was a little bit of a winding answer, but I think overall, at least the way I read Robert's sort of statement is that you don't get to just like silo your security shop and say, we're going to grow up this little arm. It's like not how we work. In order to be a really next generation force, you've got to be weaving it into the entire enterprise. Yeah,
it's a really good point. We've had a couple comments from the panelists while both of you were talking David said cybersecurity is absolutely foundational to e-safety. It has to be woven in from the start. Merritt, when you were talking about, the 1 out of 8, even as an account manager supporting my healthcare customers, and I see some of them on the line listening, all of our professional services contracts now have to go through an engineering security review. It's mandatory. It's part of the component. Even if the work that we're doing is not focused on the security team or on a security service or product, it absolutely has to be woven into our scopes of work now. So yes, it adds another review and it adds another layer, but it's embedded into every single piece of work that we do with our customers in healthcare and everywhere. For me, it's just healthcare because that's all I work on, but any professional services work that's done with any of our customers now has this security engineering review. And a shout out to James Armitage from the security engineering team. He was former head of cybersecurity for the city of Vancouver. So absolute wealth of knowledge and expertise, and we're very lucky to have him. So Drex, I'll let you wrap up with that question because I know digital transformation is, I know Merritt's a crypto fangirl, but you're the digital transformation with security lens fanboy. So final comments on that topic before we switch gears.
Sure. I mean, I would just say, without a doubt, we've rounded the corner in healthcare. We're now a technology and information services business that happens to be, providing healthcare in a lot of ways. And so for me, that means that, clinical and research and business operations, as we've plainly seen, can't function once systems are down. And cyber breaches, as it turns out, is one of the major reasons we go offline today. Even if organizations have done a really great job with business continuity planning, what we've sort of also seen is that within a few hours, our processes to support patients start to fall apart. And when it's a cyber breach, kind of figuring out when we come back online and being able to predict that time becomes really difficult, if not sort of completely unknowable. So you can spend all the money you want on all the cool clinical and business systems you like, but if they're not secured, I can tell you that nobody will care about how innovative you've been when you're in the middle of a security incident. They only care that you've been breached. So we look at this in a lot of ways like trauma centers, right? Emergency rooms. The first hour is the golden hour. If you can get a patient in for treatment an hour from the time they're injured or an hour of the time they start to show symptoms, you're way more likely to save them. And it turns out that that's kind of the same thing for cybersecurity. That seems like a super painful requirement, an hour, but in healthcare, we talk about this 1-10-60 model where you can detect an attack at an endpoint within a minute. You can triage that event within 10 minutes and then eradicate the attack within 60 minutes and remediate any damage and put the machine back in service, the endpoint back in service. And if you can do that 24/7, 365, then it's very likely you'll not fall victim to, these kinds of cyber criminals. So ultimately it's all about speed. It's being able to sort of detect and respond and remediate quickly because this is our business. If we don't do this stuff well, we can't take care of patients and families.
It's great. Thanks everyone for your insights on that. We'll shift a little bit. We can't have a security discussion without talking about people and culture shift. According to 2017 cost of data breach study, 25% of the data breaches were due to negligent employees and contractors. So obviously an effective staff awareness program is going to be critically important. Easier said than done, but tackling persistent incorrect employee behaviors is one strategy to enhance cybersecurity awareness measures. I'm going to ask each of you what some of the steps your respective organizations have taken towards this type of culture shift, recognizing, culture shift and training and people is a whole other topic and panel that we could talk for hours on, but what's working well and what challenges have presented with each of you in your respective organizations? Merritt, I'll start with you and then go to Robert.
Yeah, so sort of building off my previous monologue, I think that, as security teams become part of the dev cycles, we're hiring more dev-y people. So we like to joke that we hire lazy security engineers because we want them to script away the problems and sit there and babysit automations rather than manually doing it every time. And so that's kind of the dream, right? Of course, how that takes form in practice takes a lot of different avenues. And I think, you use the word culture. One of the most common questions I get from other CISOs is like, I want to build a culture of innovation, or I want to build a culture of security. Well, culture is what you repeatedly do. So start doing it and then you will get closer to it, right? I want to build a culture of diversity. Okay, well, the best way to do that is to do it. So I think start somewhere, but also, from when it comes to things like a culture of innovation, allow the technology to enforce some of those good behaviors. Because I think, sure, employee education is important. And as we have seen over the last couple of years with ransomware on the rise and phishing as the primary vector there, a lot of times the best avenue to defend against that might be employee education. But I also think that there are common sense ways that you can apply top-down governance, especially in something abstracted like a cloud environment, where you can deploy immediately, and you should be enforcing things like the use of short-term ephemeral credentials, no hard-coded long-term credentials, not letting people shoot themselves in the foot. And I think, there's blame is not helpful, but I do think that there are ways that you have these North Stars, like reducing human access to machines, encrypting all the things so that employees can't get access to data that they shouldn't have. And then the North Star is up here, and then how you get there may look different from a technological standpoint over time. But today, I can tell you what those look like as you enforce those. And I think that allowing the technology to kind of, now that we're doing infrastructure as code, we can do security as code, you can actually encode policies as logical formulas. So you can not only enforce some of those good things that you want to see, but you can also reason about having done them and verified through the use of things like canaries. So this is again, sort of a full circle answer, but I think the way to allow for those kind of good behaviors is to couple that kind of creative recruiting side of yourself and hiring devs and allowing them to kind of flourish in the security team. And then also having the organization itself mature to the point where you're taking some of these governance policies with a lowercase p and enforcing them through technological means.
Okay, great. I'm going to encourage the attendees to comment any ideas that they've implemented or heard about or are hoping to implement in their organizations while I go to Robert. Any thoughts or ideas around how to enhance cybersecurity awareness measures in organizations?
I mean,
it's a big question.
Yeah, as was said at the start there by Ashley, this is Cybersecurity Awareness Month, something that we've been promoting, in our organization for a number of years as well. We also have lots of partnerships with, our privacy counterparts and our corporate communications group on that sort of, broad awareness program. And so I think I'm going to focus on that sort of the human side of things, than, not what Merritt said with regards to, some of the technological things. But, we actually have a team now that we're expanding that we actually call the people control team, right? This is the controls around the people. And this is how to get that education and awareness. And we find that, just being able to reach them in ways that are not technical, and being available for answering questions when they do have concerns has been really helpful. Our corporate communications group every month develops a 3-panel comic with recurring characters that starts to deliver some of that message and gets that sort of eyeball traffic and directs people to the resources that we want to. But one of the things that we're really looking at maturing as we change out our phishing awareness campaign tooling is the real focus on working with human resources to work with the managers and the individuals to say, now hey Drex, we know that in the last year you've clicked on the test link 4 times. Well, why is that, right? And do you understand? And how do we understand what's driving that behavior? And probably it's just the fact that they're just so flooded with emails and you just click, right? So how do we throttle that back? How do we find ways of making that more important? And also, without being heavy-handed, how do we give those individuals some understanding that they have a part to play in all of this, right? It's not my team that's clicking on the link. So, as the CISO in AHS, I'm not accountable for the behaviors of every individual. I have to respond to the behaviors of every individual, but all of our managers out in the organization, that's their teams, right? How can those managers help us reinforce that? And I think that's the next maturation point in our people control program, is that program of working with HR, deploying an enterprise program, and really focusing on, the managers helping their staff.
Yeah, some really good themes and threads there around cross collaboration. I heard you talk about HR, I heard you talk about corporate communications and involving all those different teams. I've also had several requests for copies of your comics. So I think everybody's really interested in that. I think some of us also would like to be featured in said comics as characters. So we can get you that information as well.
Share Wisely or Seymour Webb to get in our comics though. So yes, we can do something for you.
Yeah. I've also got someone who said AHS uses regular phishing attempts to condition all of us minions to be on the alert for suspicious email phishing attempts. I click on the test link all the time to drive Robert crazy. It's actually a very good tool to condition personnel to react appropriately. So big kudos, I think, for those phishing links, Robert. Okay, Drex, you've got multiple lenses to answer this question, from both formerly as a CIO within a large, multiple large organizations in healthcare, and now as your role as the healthcare strategist for CrowdStrike. What are your thoughts on this and this big topic of people and culture shift?
So I mean, there was just both Merritt and Robert answered the question perfectly. There was only one little thing that I was like, I heard about this the other day when I was talking to a CIO of a health system, and I was like, just listening to that conversation and thinking this actually was a really helpful thing for them. They have phishing email tests like Robert talked about, and you get reports after the fact about who clicked on the link, and you get some idea of like where the problems are and where the challenges are. They had actually built into their corporate bonus system for their employees a process that said, for managers and directors and vice presidents, your team rolls up to you. If more than X% clicks on those links, you lose this bonus, or this bonus is deprecated by a certain amount. Now, this wasn't a whole ton of money, right? This wasn't like the entire bonus that the person could get for a year, but it was tied to money, and it drove the culture that Merritt talked about. It drove the culture of having managers and directors and vice presidents actually talk about cybersecurity and watch out for phishing as part of their everyday process anytime that they talked about work that was going on in their part of the organization. So it really did sort of force a culture change, and it didn't really cost anything to do that other than a little HR work to restructure that bonus program.
Awesome.
So that was kind of cool.
Awesome. Thanks for that. Someone asked if the recording is going to be available after. The answer is yes, it will be. We'll send the links out to everyone who joined and registered. So Merritt, I'll go back to you. In our pre-panel discussion, you said all of the things people should be doing to protect against ransomware, you should already be doing anyways, which is, a very profound statement. So can you elaborate on this and, the takeaways here? What are the no-brainer things that everybody should be doing already? And if they're not, start doing today after this discussion.
Yeah, as we all have seen, ransomware is really heavily in the news. And, I don't think that it's because it is so novel. It's been around since at least 1989, when there was a medical conference actually around AIDS, where someone handed out discs, and then people came back to their home computers, put them in, and it would crypto lock your computer and demand that you send $189 to a PO box in Panama. So, it's been around for a long time, but I think has recently found favor in part because cryptocurrency has gone up in valuation and is easier to obtain and launder. So, I think that all of this is relevant only just to say that, like, this is not, I have yet to see a ransomware attack that's being propagated through 0 days. It's stuff that you know about. It's just the fact that doing your homework and like eating your vegetables from a security perspective is hard. Like, you've got to do it. And you've got to do it every day, just like regular eating your vegetables and working out, right? So, but there are a couple of areas that I think folks we'll of course want to focus on if they are trying to get their security vegetables in. The first is patching. It sounds so obvious, but just patch everything. And of course, in cloud, that may look differently because we may take some of that. The best patching is the patching you don't have to do. So that responsibility model falls somewhat on your cloud provider and somewhat on your customer if you are in cloud. And then things like identity, so enforcement of least privilege, which of course is like a constant journey as you figure those out. No hard-coded credentials using ephemeral short term, as I mentioned, constantly kind of reevaluating your access and whether you have over permissive, things in place. So there are tools that you can use to reason about that, things like Access Analyzer, which is part of our automated reasoning group, where these math PhDs have written code that can run and tell you which identity and access management policy is more permissive, for example. Using a multi-account structure, there's ways that you can intentionally leverage the opaqueness of account boundaries. And then backup and recovery, right? There are kind of two main flavors of ransomware. One is to lock your assets and demand payment, and the other is to exfil it and then demand a ransom for them to not expose it as a breach. And so backup and recovery is critical to any good strategy around security, just because things happen, and as Werner Vogel says, everything fails all the time. But hopefully you don't feel it as a downstream effect if you've planned for it. And so, you would want to have backup and recovery. And again, in cloud, this is easier than it ever has been. You can do it at a service level through things like AWS backup, which you can also back up on premises, for example, and encrypting all your backups. You can take advantage of things like, vaults and object locks and create what feels like an air-gapped network, even if you're leveraging, ephemeral things like cloud. But of course, that doesn't affect the second brand. So you'll want to really have your kind of house in order, as well as having backup and recovery in place. And so I think, and then finally that human layer, right, which we've already hit upon a lot. So doing the education around, since phishing is the primary vector for ransomware lately, doing that employee education as kind of like that cherry on top. But these are just like a sampling of the types of things that you'll want to ensure you have in place, and that, if executed well, are going to equip you well for security challenges, of which ransomware is just one.
Great. So you heard it here, folks, from Merritt: patching, reevaluate access and permissions, multi-account structure, backup and recovery, encrypt your backups, employee education, eat your vegetables, go to the gym. Everyone can drop in their favorite vegetable in the chat. I want to make sure we've got you all listening still. And Drax, I'll let you add on to that. I mean, right on your webpage, it says, CrowdStrike says, we stop breaches. There's not really any, confusion around what that means. What are some of the CrowdStrike solutions that healthcare customers and other public sector and private sector organizations as well can leverage to mitigate the cybersecurity threats?
Sure. I mean, that was a great list, Merritt. I mean, there are just so many things that you could put on that list. The idea behind cyber hygiene is huge, and clearly one of the products of the many products and services that we have at CrowdStrike is all about sort of discovering what's on your network and knowing what's on your network, and then all the things that kind of go along with that. From a programmatic people perspective, making sure that you're upgrading. Merritt talked about patching, but some of this is just, we're really good in healthcare at buying things and then keeping them for 15 years. You have to have some sort of a process to modernize and upgrade and go down that path too. One of the things I think when we talk about this too, I think let me take just a minute and sort of talk about how or why it's important that healthcare cyber pros understand the criminals that are involved in all of this too. They've become really good, the cyber criminals or adversaries have become really good at not only specializing in the work that they do, but they've also become really great at figuring out how to collaborate with each other and work together. And that means they've kind of created companies and not legitimate companies, obviously, but companies nonetheless. And they're just as sophisticated. In many cases, they're more sophisticated than the stuff that we do today. And they're also really well organized. They have CEOs, they have CFOs, Some of them even have public relations teams so that they can engage the press when they're firing off a ransomware attack. And so we track their sort of activities relentlessly, whether it's through incident response engagements that we're doing. So we see something that's actually happening on a network. We learn from that. We have hundreds of really highly experienced threat hunters who speak dozens of languages and spend their days and nights on the dark web. We track these adversaries in lots of different ways so that we can really understand their tactics, techniques, and procedures. And that gives us a lot of information that's necessary to sort of build and update our early warning system that lets us kind of find behaviors and find criminal activity and do the things we need to do before the adversaries are able to sort of break out of that first machine and create chaos by moving, laterally in your network. And that information really is kind of part of what's at our core because of the way we've built our products. That means that anytime a CrowdStrike customer is attacked, our Falcon Complete team can do what it does, the detect, respond, and remediate within 60 minutes. And that information is then immediately available. It immediately becomes part of our cloud native tool set so that all the other customers get community immunity from that attack. I mean, it's those things that are the reason really that I'm here, because I've never really seen anything like it. I mean, it's easy to use and easy to deploy and no blue screens and no reboots, and it just works. And obviously I've gone off onto a CrowdStrike commercial. I'm sorry about that, but I'm really passionate about what we do. And I really do think it can help.
Well, as the co-sponsor of this event, we are happy to hear about CrowdStrike and the offerings, and very timely because it's Cybersecurity Month, right? Which was sort of the catalyst for AWS and CrowdStrike to come together and put this on and have Robert weigh in as a CISO of a healthcare organization. So, Robert, as we think about the future of cloud and the role that it plays in healthcare organizations, many of our healthcare customers in Canada and beyond are in the early stages of the cloud journey. A lot of customers in general are at early stages of their cloud journey. In your opinion, what ways will leveraging the cloud play a role in a future cybersecurity strategy?
Make sure I'm not on mute again. Yeah, so
no,
absolutely to the point that Merritt made a few minutes ago about the cyber hygiene. If you think back to, I think it was about January, maybe early February of 2020, there was that chip issue in the Spectre patch that needed to be deployed. We responded really quickly to that, but really quickly is much different than what like a AWS can respond. So when we're doing the planning to how to respond to that patch, AWS already has it deployed across the organization. And really from a security perspective, CISOs like myself have to understand how valuable that at scale deployment of patches is, right? It's hard for us because as Drex said, healthcare, we're really good at buying stuff and then putting it in production for 15 years. But the cloud is forcing us to be current. It's forcing us to have that hygiene. It's enabling us to have the hygiene that we'd really like and really need in our legacy environments. So I think that's the first thing, is that enablement of the rapid deployment of tools. And when we get the ability to deploy any sort of functionality from an identity service or to encryption or whatever it happens to be, we can now do that at scale and at speed. Back to what I said earlier too, our need to be able to respond and react is immensely important for us. And in a peer group that I'm a part of with a bunch of international CISOs, the number one staffing requirement from a security perspective right now is cloud security, and it's a recognition of large organizations around the world that are saying this is really hard. It's really complicated. There's no such thing as completely cloud. There's no such thing as completely single cloud vendor. So you're going to have on-premise, you're going to have hybrid, you're going to have multiple cloud vendors, and those data flows between the various endpoints and the services. You really need to understand that, how you're going to govern that. So I think from our perspective, our cybersecurity strategy is completely a recognition that that's the world that we're going to have to live in, and our upskilling for our individuals and our staff is going to be tough. And of course, it's a seller's market if you have good cyber skills right now, right? So how do you attract and retain people so that you have the ability to deal with that complex cloud environment? That's where we're at. Our security tools that we've deployed in the last 2.5, 3 years, they're all cloud-based. And again, that ability to deploy quickly, the ability to share data between cloud services, software as a service, security tools is really amazing from our perspective, but requires a different set of skills that we have to deal with for sure.
Yeah, I just wanted to pull out something that he highlighted there, which is that, if you're looking at security on our side, so we build our own custom hardware. We've got custom silicon. We have the Nitro system, which has inherent security benefits like patching with no downtime and what we generally consider to be confidential computing, where your cloud provider does not see the content of your data. And that's deliberate. There are security inheritances that you get from the fact of our custom hardware and the things that we build on our side. But I think, Robert highlighted an important thing, which is basically when you're on the security team for cloud security, what you're looking for are configuration choices. You aren't looking for the rogue server under someone's desk. You're not, and so your job is different and you're in these abstracted layers. And so I think, that's a real luxury, but it's just a different skill set of sorts. And I think, that's basically, ultimately that is the shared responsibility model, is that we do the lifting and shifting everything from the concrete floors up through layer 4, the hypervisor, and then the customer, so in this case health systems, are then doing the configuration choices on those software layers from layer 4 through 7. And of course that's deliberate because only they know what they are using it for, and you can use cloud for all sorts of deployments, right? From storage and compute and databases, we get to lots of different use cases. But I think that ultimately that means that your security team in a cloud enterprise is going to be folks that, for example, like your forensics are logging and monitoring. You're not going to get into the host. That's on our side. So it feels different because it should, and it should feel like something that you can automate more, you can do at scale, you can have really good visibility, you can tag things and be able to deploy changes at, API speed. So there's a lot of ways that this is a huge luxury and kind of enabler, and it is a different skill set. And so folks who are, thinking about getting a practitioner or certification or of whatever, I encourage you to do it, even if it's not your current role, because I think it just adds value for you to understand how these operations go.
Yeah, that's great. And, we've heard about training and upskilling staff. Part of the challenge for every organization, AWS included, is getting those right warm carbon life forms in the seats to do the jobs. But once you have them, if you do need any education or training, both CrowdStrike and AWS are more than happy to provide support and immersion days on any of the products or services or security pieces that we've got. So just contact us if you need that.
I was going to say, feel free to contact Erin. Will you put your contact in the?
Yeah, absolutely.
Yeah, and if you have an organization that could use upskilling, we can talk about, whether we can get you some free trainings or certification credits or just other opportunities to help out as you make that leap.
Yep, we've got SAs and security specialists that can do immersion days, free immersion days, just to introduce you to those security pieces. I know my colleague and friend from CrowdStrike, Justin, is on the line as a attendee who works with Drex, and I will volunteer both of them as well. Drex to advise any of the executive levels on security decisions, and Justin to support as well. So I'll put those contact pieces in. We got some vegetable feedback. We've got Brussels sprouts with lots of brown sugar. We've got tomatoes, a little more exotic. We've got an eggplant. I'm a delicate squash girl. So lots of healthy people out there. We didn't get to the topic of insurance. I'll hold that one in the back pocket. But I would like to open it up to the attendees. We've got about 40 people on the line, which is great. Lots of names I recognize and some new. So I'm going to turn it over to the audience to see any feedback or questions that we can address with this wealth of knowledge and expertise on the panel that we've got. So I'll just take a few minutes and see some of the questions that are coming in. Has everyone refilled their coffee, their water?
Yeah, yeah. I was just thinking about this, the comment about cloud too, you know, the idea of as health systems move to the cloud, it does create this ability to almost compel us to be more disciplined around the hygiene than we were when we had all the stuff on prem. I love that part of it. The challenge is, and I think, you know, you all talked about it, is just there's a shortage of cybersecurity pros, and there's really a shortage of cloud pros now too. And on-prem versus the cloud is a really different ball game. And it's really easy for you to do things, misconfigure something in the cloud and not even have a breach, but just have data exposed because of that. So the point about getting training, getting educated, making sure that, you know, folks get certs and get signed off on that, it's a really big deal. But I think that is absolutely the way to go because it is inherently more secure. There's less opportunities for bad guys to be able to exploit things that they can easily exploit on prem.
And
Yeah,
not
it's a
only-
really-
not only is it harder, it's when there is that need to respond. You know, I always joke that we have a good incident response process because we have to exercise it so often, but you know, that we can't respond at speed and deployment at scale of changes that like AWS can. So I mean, that's that sort of ability to detect and respond is better. And so I think overall, then you're more secure. People can say that you're exposed because now there's these great big targets out there, but their ability to manage, far exceeds anything that we can do, even with an organization as large as we are, right?
Yeah, it's a great point. And lots of chatter from the attendees, which is great. So someone said, apparently 90% of breaches start with a stolen credential. Adversaries are doing massive credential dumps, then walk through the front doors because they'll have the keys to the proverbial kingdom. How do you defend in the face of that? So I think that was directed for you, Drex.
Oh, yeah. Okay. That is true. We see probably 80% plus of attacks come from adversaries who have credentials, whether they bought them on the dark web or they got them in another way. And so in a lot of ways, they're not breaking in, they're logging in. And an analogy that I heard somebody use the other day that I thought was really good. You have a really nice car and you want to protect that car. And so you get, CrowdStrike Falcon Complete for that car because the bad guys come up and pull on the handles and break the windows and, get inside. And with Falcon Complete with 11060, by the time, you come out to check on the car, the window's been repaired, everything's been cleaned up and you're ready to go. But sometimes they show up with a key. And we have a service called Identity Protection that really is built around Active Directory hardening and the ability then to actually MFA everything, even legacy applications that aren't normally available for MFA. It allows you to do all kinds of really awesome, challenging, and has a really interesting, easy to use front end on it. But to get back to the analogy, the idea is that bad guy sometimes shows up with a key and they open the door and they just get in the car and try to start it. With identity protection, you have this sort of situation where the car is smart enough to be able to say, well, it's really weird that this person is starting the car at 3 o'clock in the morning because they never start the car at 3 o'clock in the morning, or that they weigh 40 pounds heavier than the person who normally sits in this car seat. So we're going to send them a multi-factor challenge before we let them actually start the car. And that's kind of this idea of an additional layer of protection that you need as we continue to sort of build out the whole set of capabilities that we have at CrowdStrike. It's an additional layer of protection that you can get that makes sure that when bad guys show up with credentials, you can make sure that they don't get to the place that they're trying to get to.
Yeah, it's a great analogy. I'm picturing my dream car that I will never have, which is an Aston Martin Vantage. So good analogy, good
Don't
visual.
touch my car, man.
That's great. And I think also, it speaks volumes of the partnership too, because these offerings, the cloud offerings that CrowdStrike has, are built on AWS, which I think speaks to the belief in the security from our side as well. So, okay, real tough question to close it out. I think you guys all thought you were going to get off easy with vegetables and takeaway points, but wouldn't be a healthcare discussion in Canada. And Merritt and Drex, I know you're both from south of the border, but Wendy said, what is the budget required to deploy these changes? Staff upskilling, transitioning to cloud services, et cetera. So pretty big question, but definitely things I'm sure that you've dealt with in your past life, Drex and Robert now. Any comments, Robert, around that sort of budgeting discussion? Huge question, but.
Yeah, I think it's important to understand that, like the immersion days that you're talking about, Aaron, there's a lot of things that are just available to inexpensively or for free. Start that upskilling. We've in the past, we've had subscriptions to training services that people can just, sort of self buy. And very, very inexpensive for the value, at that sort of base level, right? I think the real certifications and those real complex skills, those are something that, is going to take time and money and planning from an HR perspective. I think that's something that you have to work out. And it also depends on where you're at in your digital transformation journey. If you're way behind the ball and you're just starting this out, your skill set's going to be completely different than if you've automated most of your workflows into the cloud. The one thing that I would say from a budget perspective that we've come to grips with, or at least we're trying to come to grips with, is the change from a capital to an operating budget. And some organizations have a deficit of operating budget, and if your cloud workflow is all of a sudden going to consume all your OpEx, then what are you going to do? How do you work with finance and your budgeting to say that I'm not going to spend capital money, I'm not going to spend operating money, and it's a different. I mean, it's still a dollar, but it's from a finance perspective, there's some difference there. So that's not an answer to say what is the actual budget, but that's something you have to watch out for. Is the AWSs of the world are going to change potentially how you pay for things, and you're not going to be buying large storage arrays for hundreds of thousands or millions of dollars. You're going to be saying, well, here's my monthly bill for storage, right? It's a big difference, and I think that's something that people don't understand until they kind of get into the actual throes of production operations.
Yeah, great points. The CapEx versus OpEx discussion is probably, I'm sure, and I see Drex nodding, like the discussion that we hear the most. It's just a massive shift. It probably will not be surprising that we also have teams that can support with those discussions too at the executive level, to strategize and share what's worked with other customers. So I've put my email address in there, and I will be the point person to filter appropriate questions or requests to Drex or Robert or Merritt, or Justin, who's attending as well. Thanks everybody for joining, Merritt and Drex and Robert. Thanks so much for the time. It's our most precious non-renewable resource, and we're really grateful that you've invested some of it here. I hope the attendees found everything valuable and helpful. It's a topic that is very relevant and timely. And Ashley, I will turn it over to you. Wendy, I saw your question. If you want to shoot me that question via email, I will get you the information that you're looking for. So Ashley, I'll turn it over to you.
Thank you, Erin, very much. I just want to let you guys know all the upcoming industry showcases for the month. Just give me a second here. There we go. So please join us next week. We're going to continue the Cyber Security Awareness Month. And next week, on the October 21st, we have remote work, data security, and the impact of Canadian hospitals, leveraging AWS and identity security as the foundation for zero trust in healthcare, and improve your security posture for moving to the cloud. Please register at the Digital Health Canada website, and we'll see you all next week.
Yeah, I think between the comics and the radio voice of Drex, we've got something here. Stay tuned.
Absolutely.
Have a great day, everybody.
Stay
happy and healthy.
morning, or evening.
Bye-bye.
Everyone. Thank you. Bye.